Look, over the last year, we've had some really interesting conversations around racism in this country. We've also seen a denial of the impact of institutional racism on people of colour. I think it's really important to recognise the role of a government commissioned report on this, the Commission on Race and Ethnic Disparities, which said that there was no sufficient evidence for institutional racism in this country. When people of colour are being faced with racism in the streets, but also in schools, at university, in their workplaces. I mean, we saw Azeem Rafiq's testimony, a heartbreaking testimony about the realities of racism that he faces in the workplace. We know that it's institutional. We know that it's there. The government refuses to confront and engage on this. And that is a failure in relation to promoting, engaging with race equality in our society. But it's not
How
only
do
that.
we solve that problem then? Because I think that is where a lot of people differ. I think that I don't think we're a racist society. I mean, it's easy probably for me to say that. I don't think we're a homophobic society. I think that homophobia, racism, and these prejudices exist, but that is not to say that it is endemic in our society. And I think I differ with some people about how we solve that problem. But I want to get your perspective on how those problems could be solved.
I'm surprised that you say that racism isn't endemic in our society when Black women, for example, are 4 times more likely to die at childbirth than their white counterparts, when Black and ethnic minority groups were twice as likely to die of COVID-19 than white British people, when the realities facing in stop and search show young Black men 19 times more likely to be stopped and searched than their white counterparts. These are the statistics. This is what is going on. I think it's very clear that we have a serious problem around racism in our society. And what makes it endemic is that it's not simply the realities of a few people making racist remarks. It's the reality that within our institutions, built into the structures of our society, is racism that exists and penetrates in lots of different ways. That's what makes it endemic.
Well, okay. I mean, we can drill down on some of those points, but if you're going to specifically talk about something like stop and search, well, knife crime is endemic within mainly young Black male communities. That is what is happening, certainly in our big cities. And so therefore, fine, stop and search is a very crude way of solving that, but I understand why people would say, well, what other demographic would you stop if this is happening a lot within that particular demographic? Who else would you stop?
So I think, firstly, I mean, stop and search is in no way an effective tool in dealing with any sort of issues around knife crime. I think that's really important. It doesn't work. The realities are that people who are stopped and searched overwhelmingly aren't found with whatever the police believe they should be found with, but also it's highly discriminatory in its practice. It's not effective. So I think that the very notion that it is a tool that needs to be used.
What is the demographic? What is the main demographic of people? What is the main race of young people who are dying from knife crime?
Look, I think that this is not the sort of conversation that needs to be had right now around this.
But you brought up stop and search, and I'm asking you, so if stop and search doesn't work because it's racist, what is the main demographic of people who are dying from knife crime? Because I would say it's probably young Black men.
The reality that I'm talking about here is that stop and search is discriminatory in its use, that people who are being targeted in relation to knife crime in this country are not the ones who are, it doesn't make sense to kind of go after one group of people in this disproportionate way.
What is the group of people that is mainly dying from knife crime,
what we're talking about more broadly here, and this is why we're having this conversation, is the realities of institutional racism in this country. And I was just giving an example of where things are going wrong. And I think
but I'm giving you a reason as to why that your example respectfully might be flawed, because your example of as to why you believe that there is endemic racism, one of your examples was stop and search being targeted on people who are non-white, and my argument is that the reason that there are mainly non-white people who are targeted on stop and search for knife crime particularly is because that is the demographic that is dying from knife crime particularly. So that's my reasoning as to why that might be the case, and why someone listening might think, well, that's why mainly young black men are stopped and searched, because mainly young black men are dying from knife crime.
I'm just trying to say that the ways in which stop and search take place do not work. It's not effective as a tool in engaging with problems in this country. But what's more broadly the issue is that disproportionately young black men are being targeted. And that's not the right way to go about any sort of system of justice.
Okay. I mean, I don't think we're going to agree on that particular example, to be honest. But if you believe that it is endemic in society, what are the solutions? Because Joel and I have been talking this morning about how we actually go about solving some of these problems. We've seen, a lot of examples like taking the knee. We've seen a lot of examples like statues coming down, the commission regarding statues and the like. We've seen this example this morning in the newspapers about multiculturalism not being embraced in the way it should be. I mean, do you agree with any of those tools, or do you think that there are other ways in which it can be solved?
I think that there are sort of key issues here that need to be engaged with. We need to look at things like what equalities legislation there are to support people of colour in this country. So, for example, Section 1 of the Equality Act, the socioeconomic duty, looking at supporting people regardless of their class background in accessing public services. That's a key example of an action that should be taken to support Black and ethnic minority communities enacting this. Then there needs to be looking at sort of health inequalities in our society, a review into the extent of health inequalities in our society facing people of colour. There are countless actions that need to be taken. It's not just, it goes beyond sort of taking the knee. It's about really thinking about sort of processes that need to be put in place to support Black and ethnic minority people.
So why do you think that Black and ethnic minority people aren't getting the kind of healthcare that they need? Because I find that really interesting. I mean, do you think that they are less likely to want to go to the doctors? Is it as simple as that? Is it that when they do go, that they're perhaps not getting the kind of care that they should? Where and how is that happening?
So there are a number of really important structural inequalities that inform access to healthcare for Black and ethnic minority groups. I mean, the reality is where you live, where you work, they all inform what sort of healthcare you're receiving. So we need to look at sort of that structural level. It's also about, confidence and access. So if you don't feel confident in accessing the healthcare that you need, it's going to impact sort of the quality of healthcare that you receive. So there are sort of problems within all parts of that sort of access that have informed also what's happened around COVID-19 as well in relation to Black and ethnic minorities.
So how would that then be solved, do you think?
I mean, the steps that need to be taken are kind of wide-ranging. Firstly, you need to be thinking about what a deep-rooted review needs to be done to look into the extent of structural inequalities facing Black and ethnic minority people in the healthcare system. We also need to be thinking about things like vaccine hesitancy, how to engage in a more sincere way with communities who are worried about the healthcare that they receive, that doesn't look to sort of belittle them and belittle their fears, but also seeks to engage more genuinely, make sure that they have access to the primary care that they need in a way that feels open and accessible for them. I think those are some of the key steps that should be taken.
But I'm trying to drill down why. I mean, why do you think someone... I mean, because you've mentioned sort of class and location and things like that, but I'm trying to sort of drill down, why would someone who is not white have more hesitancy about accepting medical help or seeking medical help than someone who's white? Because there are going to be people listening to this saying, well, I don't get why. We don't get why.
Look, for a long time, the healthcare system has failed Black and ethnic minority communities in this country, and in lots of ways. So what's really important here is, for example, that Black women are 4 times more likely to die at childbirth. There are clear examples in which Black and ethnic minority groups have had experiences of discrimination in the healthcare service and are extremely worried about sort of accessing and cautious about accessing the healthcare that they need in terms of sort of vaccine hesitancy and beyond. And of course, the healthcare service does incredible things to support Black and ethnic minority communities, but this comes up against a long backdrop of public services not working in the way that Black and ethnic minority communities need them to work for them. And so I think that's sort of where these things come from. There's understandable caution when a society isn't working in the way that it needs to work for you.